If your summer feels itchier than usual, and you find yourself constantly reaching down to scratch your arms or legs, you're definitely not alone. This year, the familiar buzz of mosquitoes seems louder, and the bites more frequent. It's not just your imagination, mosquitoes are out in full force, and they're bringing more than just itchy welts. In fact, if you've noticed an uptick in mosquito activity, you might be witnessing the early signs of a much bigger problem brewing in your neighborhood. You've probably seen swarms of mosquitoes hovering around streetlights, or maybe you've caught yourself swatting at them during a walk in the park. It's almost as if these tiny pests have multiplied overnight, turning every outdoor gathering into a battle zone. And if you feel like there are more mosquitoes than relatives at your last family reunion, you're not exaggerating. This year, the mosquito population has exploded, and with it, the risk of mosquito-borne diseases has shot up as well. If you're in Guangdong right now, you're at the epicenter of China's latest health concern, a chikungunya outbreak that's making headlines across the country. Guangdong, known for its bustling cities, vibrant street life, and subtropical climate, has unfortunately become ground zero for this rapidly spreading virus. The region's warm temperatures and frequent rainfall create the perfect breeding ground for mosquitoes, making it especially vulnerable to outbreaks like this one. But what exactly is chikungunya, and why is it causing so much alarm? Chikungunya is a viral disease transmitted primarily by Aedes mosquitoes, those same notorious insects responsible for spreading dengue and Zika. These mosquitoes are easy to recognize. They're small, dark, and have distinctive white markings on their legs. Unlike some other mosquitoes, Aedes are aggressive daytime biters, which means you're at risk even during your morning jog or afternoon stroll. When an infected mosquito bites a person, it injects the chikungunya virus directly into the bloodstream, setting off a chain reaction of symptoms that can be both sudden and severe. The symptoms of chikungunya usually appear within a few days of being bitten. Most people experience a sudden onset of high fever, sometimes as high as 40 degrees Celsius, accompanied by intense joint pain. Imagine waking up one morning and feeling like your knees, wrists, and fingers are staging a full-scale protest against you. The pain can be so severe that it makes even simple movements difficult. In addition to fever and joint pain, many people develop a rash, headaches, muscle aches, and overwhelming fatigue. It's not uncommon to feel completely wiped out, as if you've been hit by a truck. While most people recover from the fever within a week, the joint pain can linger for weeks or even months. For some, the discomfort is mild, but for others, it can be debilitating, making it hard to walk, write, or even hold a cup of tea. Doctors often compare the lingering pain to the after effects of a bad flu, but with a stubbornness that refuses to go away. In rare cases, the pain can persist for years, especially in older adults or those with pre-existing joint problems. It's a reminder that even after the virus has left your system, its impact can stick around like an annoying pop song you just can't get out of your head. Right now, the hardest hit areas are in southern China, with the city of Foshan reporting thousands of confirmed cases. Hospitals are seeing a steady stream of patients complaining of fever, joint pain, and rashes. Local health authorities are on high alert, working around the clock to track new cases and prevent the virus from spreading further. The outbreak has put a strain on medical resources, but so far the response has been swift and coordinated. Community health workers are going door to door, educating residents about the risks and symptoms of chikungunya, and urging everyone to take precautions. So, what's fueling this outbreak? The answer lies in the weather. Weeks of heavy rain and high humidity have created ideal conditions for mosquitoes to breed. Puddles, clogged drains, and even small containers left outside can become mosquito nurseries almost overnight. With so much standing water around, mosquitoes are thriving, and so is the risk of chikungunya. Climate experts warn that as global temperatures rise and rainfall patterns become more unpredictable, outbreaks like this could become more common in the future. The good news is that for most people, chikungunya is a mild illness. Nearly all cases resolve on their own, and most patients are able to leave the hospital within a week. Severe complications are rare, and deaths from chikungunya are extremely uncommon. Doctors recommend plenty of rest, fluids, and over-the-counter pain relievers to manage symptoms. Still, the experience can be miserable, and the lingering joint pain can disrupt daily life for weeks or months. If you or someone you know develops symptoms, it's important to seek medical attention, especially if you have underlying health conditions. One thing you don't have to worry about is catching chikungunya from other people. The virus isn't spread through coughing, sneezing, or touching surfaces. It's not like the flu or COVID-19 where person-to-person transmission is a major concern. The only way to get chikungunya is to be bitten by an infected mosquito. So, while it's always a good idea to practice good hygiene, you don't need to avoid crowds or isolate yourself if there's an outbreak in your area. That said, the best way to protect yourself is to avoid mosquito bites altogether. This means taking a few simple but effective precautions every day, especially if you live in or are traveling to an area with reported cases. Start by using a mosquito repellent that contains DEET, picaridin, or oil of lemon eucalyptus. Apply it to all exposed skin and reapply as directed, especially after sweating or swimming. Mosquitoes are most active during the early morning and late afternoon, so be extra vigilant during these times. In addition to repellent, wear long-sleeved shirts and long pants whenever possible. Light-colored clothing is best, as mosquitoes are attracted to dark colors. If you're spending time outdoors, consider using mosquito nets or screens to keep the bugs at bay. And don't forget about your home. Make sure windows and doors are fitted with tight screens, and use air conditioning if you have it. One of the most important steps you can take is to eliminate standing water around your home. Mosquitoes lay their eggs in water, and even a small amount can be enough to support a new generation of pests. Check flower pots, buckets, bird baths, and any other containers that might collect rainwater. Empty them regularly, and scrub them out to remove any mosquito eggs that might be clinging to the sides. If you have a pond or water feature, consider adding mosquito-eating fish, or using larvicides to keep the population in check. Local authorities are stepping up their efforts as well. In some areas, they're releasing mosquito-eating fish into lakes and ponds to naturally control the mosquito population. These fish feed on mosquito larvae, helping to break the cycle before the insects can mature and spread disease. In other places, scientists are releasing so-called elephant mosquitoes, a harmless species that preys on the larvae of disease-carrying mosquitoes. These innovative approaches are part of a broader strategy to reduce the risk of chikungunya and other mosquito-borne illnesses. Technology is also playing a role in the fight against chikungunya. Drones equipped with cameras and sensors are being used to survey large areas for potential mosquito breeding sites. These high-tech tools can quickly identify stagnant water in hard-to-reach places, allowing authorities to target their efforts more effectively. In some cities, drones are even being used to spray larvicides over large bodies of water, reducing the mosquito population on a massive scale. Public health officials are urging everyone to stay informed and take the outbreaks seriously. Regular updates are being shared through news outlets, social media, and community bulletins. If you receive a notice from your local health department, take a moment to read it and follow the recommended guidelines. Remember, protecting yourself from chikungunya is a community effort. The more people who take precautions, the lower the risk for everyone. So as you go about your summer, keep an eye out for mosquitoes, take steps to protect yourself and your family, and don't hesitate to spread the word to friends and neighbors. When it comes to mosquitoes and the diseases they carry, a little paranoia can go a long way. Stay safe, stay informed, and hit subscribe for more updates on how to keep your community healthy and mosquito-free.